Well, good evening. My name is Aaron Spence. I'm the superintendent of schools here in Virginia Beach City Public Schools, and it's our pleasure to be with you tonight as we are here to discuss our proposed plan for the opening of the new school year during this community information session and to answer many of the questions that we have received from you, our community and family members. I know you'll understand that this plan is the culmination of 3 months of work by our exceptional central leadership team, many of whom are on this call this evening to help answer the questions that we have received. The recommendations that are within our fall 2020 plan that was shared last Thursday with you and with our school board encompass many aspects of our recovery planning efforts, which include important health and safety measures for safely opening our schools and all of the logistics that are involved with that. And of course, our plan also includes a detailed explanation of the instructional components for both in-person instruction and virtual instruction. With all of that, we know we can't answer all of our questions in a plan, and so that's the reason for this information session, as well as a workshop that we'll hold with our school board tomorrow night, and certainly the FAQs that are posted on our website, which we will continue to update well after this meeting tonight. Before we begin talking about the plan, I do want to reiterate that our priority throughout this process has been the health and safety of our staff, our students, and our families. And our other guiding principles that have helped us as we've been working have been the need to be prepared to make decisions based on evolving health data and guidance from health officials at the local and the state and the national level. And of course, we've not lost sight of the need and the importance of having students in school and the importance of social and emotional learning and mental health supports for our students and our staff. As our community might be aware, just in terms of a bit of a timeline, in June, the Virginia Department of Education released its phased guidance for school openings. Shortly after it released that guidance, it also signaled that ultimately any decision that needed to be made would be made as a local decision and should be informed by seeking advice from local health experts. This guidance by the VDOE was consistent with the emerging and evolving recommendations from the American Academy of Pediatrics and the CDC, who suggested in their documents that local health data should be an important component in deciding when and how to safely reopen our schools. Because of this, we shared with you all last week, and I know that I convened an advisory panel of physicians and public health experts to help us understand and put into context our local health data. More than just understanding how to open schools, I also wanted to understand when to open schools safely for face-to-face instruction, which is, of course, we all agree, the most important thing that we can do, getting back to normal as quickly as possible, but doing so safely. So the panels met several times and includes experts and physicians from a variety of specialties, which include public health and pediatrics, emergency medicine, primary adult care, infectious diseases, to name a few. And this group was tasked with drawing on their experience to develop a set of health metrics that could be used to help us determine when and how it would be safe to reopen schools for in-person instruction. So as I've stated, I want to be clear that our decision to open or close our school buildings is going to be based on health data, and it specifically will be based on CDC guidance and guidance from the DOE, the Virginia Department of Health, and on these regional health metrics that have been provided to us by our local medical professionals. Speaking of guidance from the CDC, it is worth noting that just last Thursday, the CDC issued a statement on the importance of reopening America's schools this fall, and within that document, and published simultaneously, are companion guidelines from the CDC for preparing a safe return to school in fall of 2020. These CDC guidelines state that administrators should make decisions in collaboration with local health officials based on a number of factors, including the level of community transmission. So I'm pleased that this is the approach that we've taken to develop what is described in the reopening plan as green, yellow, and red health monitoring metrics to quantify the level of transmission of COVID-19 in our community. It's also worth noting that these recently published guidelines of the CDC reinforce that, and again, I'm quoting, "The health, safety, and well-being of students, teachers, staff, and their families is the most important consideration in determining whether school closure is a necessary step. Communities can support schools by staying open by implementing strategies that decrease a community's level of transmission. However, if community transmission levels cannot be decreased, school closure is an important consideration." and that plans for virtual learning should be in place in the event of a school closure. So all of this reinforces that our plan is the right way forward, and we do look forward to a discussion with the school board about that tomorrow night. In the meantime, we do look forward this evening to answering questions that we have received from our community and our families. And to facilitate that, I will now turn this over to Robert Jameson, who is our coordinator of school counseling services. Mr. Jameson.
Thank you, Dr. Spence. Before we begin, I'd like to thank all of our panelists from our various VBCPS departments who have worked collaboratively and diligently really on the fall plan for 2020 to ensure, much like you had outlined, Dr. Spence, that all students, parents, and staff are safe and that students will be receiving high quality instruction excuse me, throughout the 2020 school year. Would also like to thank the over 900 community members who submitted their responses. We received questions focused on health and safety, transportation, and instructional learning. And as again you outlined, we hope to answer several of these questions tonight and provide some clarity and confidence in this 2020 plan. So at this time, I'd like to introduce our lead panelists. Each lead panelist has brought representatives from their teams to respond to or elaborate on the various questions that will be posed tonight to our VBCPS staff. I want to start by introducing Dr. Kip Rogers. He's our Chief Academic Officer. Mrs. Danielle Colucci, Executive Director of Elementary Teaching and Learning. Mr. Matthew Delaney, Executive Director of Secondary Teaching and Learning. Dr. Ronnie Myers-Dobb, our Executive Director of the Office of Programs for Exceptional Children. Dr. Don Robertson, Chief Schools Officer. Mr. Jack Freeman, Chief Operations Officer. And again, we are joined tonight by Dr. Aaron Spence, our Superintendent. So as we get things started, we'll have our various teams responding to some questions. And Dr. Rogers, I'd like to start. As we look through the questions, there was a clear theme in terms of wanting to know the difference between some of the terms that we have heard since the end of last year and going into the beginning of this year. So the first question, what is the major difference between the emergency learning plan, remote learning, and the virtual learning center? Let's see. And Dr. Rogers, I believe you still might be muted.
Apologize. Thank you for asking that question, Mr. Jameson. I did review the over 900 questions and responses, and many of which had questions about the differences between the emergency learning plan. First, I want to paint a little bit of context, though. This coming fall, we will have entered our fourth phase, if you will, of what teaching and learning looks like in Virginia Beach City Public Schools. In direct response to the school closure, we entered into our continuity of learning, which was really a response because we didn't know what was going on. Shortly thereafter, we entered into our emergency learning plan where we started new learning and were really responding to an emergency crisis. And that meant that school in a traditional sense looked very different from what we were accustomed to. In an effort to focus on recovery, we shifted into summer learning, where we got a little closer to where we would like to be. Certainly had a lot of room to grow, but it certainly got us closer in addressing the needs of our most needy students, as well as thinking about how teaching and learning would look come fall. Transition into this coming fall, what's going to be different is teaching and learning in general. The rigor as well as the differentiation that we're planning for as related to curriculum instruction and assessment will look completely different from what it looked during the emergency learning plan. As many of you all know, many of our students have suffered trauma, as have some of our adults, to be quite honest. And we have to focus on the social and emotional well-being of not only our learners, but as well as our adults. So we will spend a lot of time focusing on what that looks like with daily instruction. You can count on the curriculum and instruction for this coming school year being more rigorous, including formative assessments to gauge where our students are all throughout the learning process for the fall and certainly into the spring. The biggest difference, two biggest differences from the emergency learning plan and going into the fall, is that attendance is going to be required. Meaningful interactions will be monitored. We will support students where they are. We recognize that that comes with a little bit of challenge, but we are certainly going to be flexible as directed from the Virginia Department of Education. And the other piece is that all assignments for our face-to-face and virtual learning, whether it's the temporary virtual learning option as a result of the face-to-face option not being possible, and the virtual learning center, those assignments will be graded and students will receive ongoing feedback all throughout the course of their study. And then lastly, what's going to be really different is the ongoing feedback that we'll provide to our teachers and our administrators to ensure that they're able to provide the most efficient, the most effective professional learning and teaching and instruction and assessment that we can get to our students in whichever environment we come back to school in. So those are the largest differences that we have as compared to the emergency learning plan that took place this past spring.
Thank you, Dr. Rogers. I actually have a few, I think, related questions to those options that you just, or the definitions that you just provided for those terms. And they are related to the options that are available to our families. And the first question that comes up, as one parent wrote, may I change between option 1 or option 2 anytime?
So if families select option 1 or option 2, they are being asked, we're asking that all families stick with that option for at least a semester. And that there's a multitude of reasons for that, but primarily because from the face-to-face option, we're confined by restrictions for safety in the face-to-face option. So if you select the option 1, which is face-to-face, and we have to account for social distancing, we have to account for all of the safety measures that accompany being involved in a face-to-face setting. And if we allow families to switch from the virtual setting to a face-to-face setting on an ongoing basis, it presents quite a bit of challenges, not only in the physical space, but also with transportation. Additionally, with the option 2 space, we have staffing that we have to think about in terms of who's going to teach those students throughout the course of the semester. And we have got to make sure that we are being conscious of that to not present as many problems as it could should we allow families to choose one option over the other on an ongoing basis.
Thank you for that. As an actual follow-up for Mrs. Colucci, you or Dr. Rogers making reference to that virtual setting and how instruction will be provided and therefore will still be rigorous with those expectations. So if Mrs. Colucci, as a follow-up to that, what training have the current teachers had to be able to teach virtually to the level that parents expect?
Well, good evening, everyone. That's a great question. I first want to extend our gratitude to our teachers. They were incredibly positive and worked extremely hard since March 13th and learned so many new strategies and tools to implement within their instruction. When we were notified we would be moving into a virtual learning environment, we immediately began to develop support for teachers through instructional coaches in teaching and learning and at the school level to ensure teachers felt they had partners to help them co-plan and co-teach, and that they could learn the digital tools that they would be using to deliver instruction, such as Google Meet, Schoology Conference, and Zoom. Our instructional technology coordinators and specialists really worked tirelessly to create a website as well, containing training videos, exemplars, highlighting effective digital tools and how to utilize those to provide aligned instruction. Each Monday provided us the great opportunity to collaborate among ourselves as teachers and co-plan with coaches and learn about those tools for best practice in a virtual environment. As far as how PL professional learning for the upcoming school year will be provided to enhance what we've already learned, we have already provided professional learning in June to teachers called their essential sessions. And the focus of those was how the curriculum, and Dr. Rogers spoke to this briefly, has been enhanced, the additional pre-assessments that have been added to help our teachers identify any learning gaps, or as well as students who may need more challenging small group instruction to meet their needs. So that was the first step we took to really ensure the pedagogy and the standards and any highlighted areas that have changed in our vertical articulation were very clear to teachers. Our next steps will be to provide professional learning in August on how to meet the expectations of virtual learning, how to grade, how to assess, strategies to deploy to meet the needs of our students. An emphasis will be placed on social emotional learning and building a community with our students, and how to do that as well with parents in a virtual environment. We are very fortunate in Virginia Beach to have curriculum specialists and school instructional coaches in all of our schools. We have reading and math specialists, gifted resource teachers, library and media specialists, gifted resource teachers, and the instructional technology specialists at the school level, who all play a critical role as well in supporting staff and understanding best practice for synchronous and asynchronous instruction. We're also really proud that part of our professional learning will highlight how to provide students hands-on learning experiences as well, even though we're in a virtual environment, so that we provide our students with a balance of screen time and non-screen time, and utilizing balanced assessment to provide them multiple opportunities and different ways to demonstrate their learning.
Thank you. There's actually a couple follow-up questions related to a few things you just mentioned. And this could be for the teaching and learning teams, Mrs. Colucci, Dr. Rogers, Mr. Delaney. Just wanted to dive a little bit deeper. Several questions were received in regards to synchronous and asynchronous learning. And what exactly does that mean? What is the difference between the two?
So I'll take that question, Mr. Jameson. And that's a good question. And more often than not, people get the two of them confused. Synchronous and asynchronous are very similar. With synchronous learning is the kind of learning that happens in real time. And it's very much like what we're doing right now through Zoom. We're interacting with each other in a real-time fashion. And this means that students and their classmates and their teacher have an opportunity to interact with each other through a specific medium and during a specific time or at a specific time. In other words, it's not exactly anytime, anywhere, anyhow. And the methods of synchronous learning can include video conferencing, very much like what we're doing now. It could also include teleconferencing or interacting with a group of students via telephone. It could include live chatting. As you know, there's a chat feature within Zoom, and as well as with some of the other medium that we use in Virginia Beach, where students are able to chat with the teacher and with small groups. There's also live streaming lectures that's considered synchronous instruction, where a student is sitting at a computer and the teacher is teaching live in another setting. And that's pretty much lecture-based, but all of those examples are examples of what synchronous learning is, and when teachers and students are in sync with each other. Conversely, asynchronous learning happens on the student's schedule and not necessarily in a just-in-time fashion. And in that aspect, you have a course of study where the instructor is able to provide materials that a student can access when it is most convenient to them, or at agreed upon times, where the instructor might provide materials for reading or for writing, or perhaps the teacher may record a lecture that a student can view at another time that has an associated activity with the recorded lecture that's there for viewing. They may provide students with assignments for completion. It could be a project, it could be an essay, it could be a creation of an art project, could be pretty much anything that's pre-done. There is also an opportunity for students to take exams for evaluation. That's an asynchronous opportunity. And the students have an opportunity to access or to satisfy these requirements within a given time frame. So for example, if I've given you all as a class an assignment this evening, or we're not face-to-face, and I give you a specific time with which that assignment is due. And the methods of asynchronous online learning could also include self-guided lessons and modules, very much like what you'd find in a virtual Virginia setting, streaming content that students can access at a different time. We have virtual libraries that students have access to, posting of lecture notes that students have access to, and having an opportunity to exchange across discussion boards. So for example, if I posted a question and I give a group of students an amount of time to respond to that question, and perhaps they had an opportunity to do some research. So those are the differences between synchronous and asynchronous instruction. And one of the differences, another difference between the emergency learning plan and how we're planning for teaching and learning this coming fall is increased opportunity for synchronous opportunities for students to be able to interact directly with their teachers in a live fashion.
Thank you, Dr. Rogers.
Certainly.
With that as our, I think as a background for the synchronous and asynchronous opportunities for instruction that our students will have, as you can imagine, some parents, of course, have questions regarding the needs of their children and how those needs will be met. And so, Dr. Myers-Dobbs, some parents had questions or concerns about children with disabilities. How will IEPs be implemented during option 1 and option 2?
Hi, good evening. Yes, so when we start the beginning of the school year, there are going to be IEP meetings held for each student. And for those students who parents choose option 1, which is the face-to-face learning option, IEP meetings will be held for each student to discuss any modifications to address services and supports that students require when we transition to that temporary virtual instruction. And then as well for students whose parents choose option 2, which is the 100% virtual learning, IEP meetings will also need to be held for each of those students to address any needed modifications to address the services and supports that'll be required of those students when they participate in the virtual learning center. And then case managers will create a schedule for themselves to meet the needs of each student on their caseload to ensure the delivery of services for each of those students, whether it's in the virtual, general, and or special education setting. And they will continue to collaborate with general education teachers to provide those supports for students with disabilities in the general education setting, and then use small group and or individualized instruction to address IEP goals when appropriate. And I know that one of the other questions was related to transition services. So students with disabilities will also continue to participate in coordinated activities, which will be aligned to the post-secondary goals in their transition plans.
Thank you. Related to our student groups, Dr. Rogers, we have our students who are English language learners. We also have students who are supported through 504 plans. What are some of the different supports that will be available to our families and to our students, of course, during this remote learning, or during options 1 and option 2? Dr. Rogers, I believe you're still muted.
Yeah, I apologize. Thank you. The English language learner teachers, or ESL resource teachers, will have an opportunity to push into the ESL classes at the elementary level for option 1, certainly. And they will be assigned to schools to provide direct instruction to our students at those schools. Again, they will have an opportunity to push into those classes. They'll also have the flexibility of being able to utilize small group instruction for our elementary students as needed, leveraging what I refer to as the synchronized instruction, where they're able to break off into small groups and deliver the needed instruction for our English language learners. Again, as needed. Students who choose option 2, which is the virtual learning center, will also receive support from an assigned ESL teacher within that virtual learning center. So with either option, those students will certainly be able to have a little more purposeful and strategic assigned intervention with the ESL teacher than we were able to do with the emergency learning plan. So we're certainly planning for that. With the Section 504, our 504 teams at each school are going to be able to support parents, both parents and students who are eligible for Section 504 plans. Each school has a Section 504 administrator, which is typically an assistant principal, as well as a Section 504 coordinator, which is more often than not the school counselor that's assigned to each school. And the teams are available certainly for any parent or family to discuss any concerns or accommodations that students may need during virtual learning. They're certainly willing and expected to do that. The Section 504 administrator and coordinator provides guidance for all of the students and their families in order to determine the accommodations that are needed for the upcoming school year. And those meetings are certainly in the process of being scheduled and held now. And if any parent or family has any questions or concerns about 504s on how to navigate that, if they had one last year and have some additional questions, they're certainly able to contact the school to discuss those concerns and to schedule a meeting if needed.
Thank you. I was actually about to echo the same sentiment of, we're still here. We haven't gone away. We're a phone call away. We're an email away in terms of being able to provide support, whether at Office of Programs for Exceptional Children, English language learners, and the other student groups, students with disabilities are eligible under Section 504. I just wanted to share that. School counselors and the administrators across our school division, definitely here and readily accessible whenever needed. Wanted to shift gears related to the different accommodations that we oftentimes provide when it comes to testing. And there were some questions related to testing that I wanted to share or I posed towards Mr. Delaney. As one parent wrote, how will my child be assessed on his learning? Will the teachers be available to help him or her if, reinforcement or reteaching is needed?
Yes, certainly, as we're looking, thank you, Mr. Jamison, as we're looking at the assessment processes as we re-enter, there's really two ways we have to kind of address the assessment. One is what we call gap assessments. We've got to identify the gaps in learning that may have existed from the spring. And then we have to effectively assess the new learning, the standards that they're using right in front of them, that they're learning at the current time. So we also want to be mindful of not over-assessing students when they come back. Dr. Rogers illustrated at the opening of his comments around the importance of social emotional learning. We really want to be strategic in how we have students re-enter the building. So we are working on very quick, formative, short assessments so we can identify gaps and use that data to inform our instruction, whether it is to reteach or whether it is in many cases to provide enrichment for students that are demonstrating mastery in some of those skills. I'll give you an example. Our 6th grade group is looking back at 5th grade standards, ensuring that we're doing many assessments for those rising 6th graders to identify skills that they may be deficient in that are necessary for them to be successful in a 6th grade class. So we're having a combination of those assessments. We typically have a lot of common assessments that we use across units. And again, very importantly, we use that data to support the instruction moving forward. I want to reiterate one more time and reinforce we do not want to over-assess kids immediately when they come back. We understand that reentry into a remote learning environment is going to be challenging, and it's going to be a little bit, as Dr. Rogers expressed, it's not the same as the emergency learning plan. The expectations have increased, and we have to make sure that we're supporting students in ways that they can be successful in that reentry.
Thank you, Mr. Delaney. And I just want to also reinforce a point Dr. Spence had brought up earlier. We will have that FAQ page. There's a lot of information that's being shared right now. And that FAQ page will definitely, off the VB Schools website, will be updated, make sure that it's something that's easily accessible for our families. And related to, that question regarding assessment and the gap assessment and making sure that we're looking back at previous years' instructional materials to build the necessary skills and knowledge as our students move forward. There, of course, comes the summative piece and the standardized testing question from our families. And Mr. Delaney or another member from Teaching and Learning, one question came in asking, will there be SOLs this year? And specifically, if my high school student still needs verified credits for graduation, how will that be handled? So part one, will there be SOLs this year?
I think we are still waiting on information from the Virginia Department of Education in terms of the SOL schedules. Any type of conversation that a parent has regarding verified credits, they should take that directly to their school counselor at their home school, and they can certainly provide them with that information.
Definitely. And that latter part of that question, thank you for saying that, it's counselors, again, tracking graduation requirements. That is something that's inherent to the work. Phone call, email away throughout the summer. Support can definitely be provided, and we're here to assist where possible. In terms of the various needs for our students, I want to go back to another question we had received, and this, again, for the teaching and learning team. One specific question stated, during virtual learning, how do we, as a school division, plan to identify and support gifted students?
I'll take that question. Thank you for asking it again, Mr. Jameson. The gifted resource teacher, we refer to them as GRTs, will certainly have a lot more opportunity than we did in the emergency learning plan to plan differentiated lessons and activities and learning experiences with the gifted cluster teachers that are housed at each of our schools. And the way in which the schedule is structured, it lends itself so that our GRTs are able to not only plan, but to also coach and to implement lessons and activities directly in the classroom alongside with the teachers. The GRTs will certainly push into classes to provide support, whether we're in the virtual setting or in the face-to-face setting. And all of our gifted students will certainly be able to have access to their gifted resource teacher. And of course, if you have any questions as parents, by all means, I encourage you to please reach out to your gifted resource teacher.
Thank you again, Dr. Rogers. I know that we make a concerted effort to meet students where they are and make sure that their needs are met and are addressed, and highlighting the fact that we value multiple pathways and personalized learning for our students. And as an extension to my last question in regards to identifying and supporting our students who are identified for gifted services, I want to jump back actually to one of our questions related to options. And if a family were to select or is to select, option 2 with the virtual learning center, question that did come up, will my child have access to all courses and programming options such as ODS, Old Donation School, or any of our academy programs?
Dr. Rogers, I can take that if you'd like. Obviously in both of those scenarios, we want the students to maintain their connection to their academy or to the ODS. As Dr. Spence or Dr. Rogers shared earlier, if a family selects option 2, that is a semester-long commitment, which means they would have the potential to return in the second semester to face-to-face instruction, and therefore should be allowed to maintain their standing in ODS or a new academy program. So if choosing option 2, for example, when possible, academy students will receive instruction from their academy teacher. If that's not possible, they will receive that instruction from a virtual learning center teacher and then provided additional extension supports from the academy. From the ODS perspective, as you know, they receive gifted services. So if they were choosing option 2, they would also look to receive that support from an ODS teacher as possible. If not, they would receive support in the virtual learning center from a gifted resource teacher, again with communication coming from ODS. In meeting with the ODS principal and meeting with academy coordinators, they are extremely dedicated to ensuring that they can provide the necessary service to their academy students and ODS students. We're extremely fortunate for those programs, and we understand how important those are to students. And as we've talked about, choosing option 2 was typically a choice that is made for health reasons and not due to any other reasons, and we did not want to remove that opportunity from students to still to participate in that.
Thank you, Mr. Delaney. And Dr. Rogers, you had mentioned earlier, and this question really will be posed to the team, but you had mentioned quite, I'd say clearly, in terms of synchronous and asynchronous learning, the different ways that is provided. But we did get a few questions, and again, open to the team. I recognize it may change by level of instruction, elementary, middle, and high, or elementary and secondary, to simplify that. But the question stemmed from, how will instructional materials be delivered or distributed to our students?
Sure. Thanks, Mr. Jameson, for asking that question. We use Schoology as our learning management system that houses all of our curriculum. And students and families have access to the Schoology platform. And we took a close look at the feedback that we received from our families through the continuity of learning, through the emergency learning plan, and through summer, and looked at the recommendations that they gave us in terms of how to make accessing the instructional materials better. And our team is working to set up courses similarly across grades K through 12 so that it's easier for our students and families to navigate in finding where assignments and assessments and resources are within the scope of the Schoology learning platform. And as our teachers prepare to welcome students back and prepare welcome materials for families, directions on how to access the instructional materials will be shared at that time. And I'm excited about some of the resources that we've secured over the summer to make navigating the instructional materials that we have for our students a little easier. We have students that start kindergarten and not quite sure how to navigate that. We certainly are taking that into consideration and providing opportunities for training for not only students, but certainly for parents as well, to help them and caregivers to help them be able to better navigate the instructional materials that we have to offer, whether it be in a live face-to-face setting or whether it be through the VLC. And we're looking forward to sharing those pieces of information in the system with that. So.
Thank you, sir.
Certainly.
I think we have time for maybe one or two more questions. And one of the questions that did come up related to the different course offerings. Again, Mr. Delaney, I know you had mentioned access to academy programs, access to ODS, maintaining the different opportunities that we have currently for our students moving forward. One specific question was, will career and technical education classes be available online?
Yes, students will, yes, Mr. Jameson, students will be able to access CTE questions just like, classes remotely, just like they do their core classes. We understand the challenge that presents in some cases, and what we're proud that has occurred over the summer through planning is that high school students will have access to Windows stations, Mac stations through CTE computer labs that will be connected to their Chromebooks. We understand the significant importance of industry credentials on the high school level, and we want to make sure that students are prepared for that moving forward. We are also in the process of putting together materials kits that can be used in some courses to support the remote learning environment. So yes, we are excited that we'll be able to offer those courses in a remote environment, and much like the entire reopening plan, at an increased level of rigor and an increased level of expectations.
Thank you. And I think really to wrap it up, it's two shorter questions that we had that, again, were recurring as part of our frequently asked questions and directed to Dr. Rogers. And based on what I'm reading, I could potentially help in providing a response to. But the last few questions we did receive were related to the following. Will virtual learners have will be able to readily access school counselors? Part one. And then part two is a little bit different in terms of related service. So I'll actually split the questions. But will virtual learners have ready access to school counselors?
Absolutely. Thank you, Mr. Jameson. Yes, our school counselors have done a phenomenal job since March 13th in engaging students and their families and how to navigate being out of school for this extended period of time. And I can do nothing but thank them for all of the hard work that they've done in terms of making phone calls and sending emails and even making home visits to make sure that our students are safe and cared for, and if they don't have the resources that they need, that they certainly do everything in their power to help and assist other staff members in our school division to get them what they need. So our counselors are absolutely available for our families and students. They are currently, as you mentioned earlier, available now, and they certainly will be available regardless which option they choose, whether it's option one with the face-to-face option, with the temporary virtual option, and certainly with the VLC option.
And thank you. As a coordinator of school counseling services, I do want to take a moment and thank everyone who is serving as a panelist for all the support that is provided to school counselors to then help them better assist our families and staff members across our school community. So a special thank you to everyone, including you, Dr. Rogers, for your leadership, and everyone else in senior staff for allowing that to happen. My last question is very straightforward, but one that is very important to our 15 and 16-year-olds. For 10th graders, what is the plan for driver education and the behind the wheel option for those with learner permits?
Yes. So behind the wheel will certainly continue to take place as long as it continues to be safe to do so using health mitigations that we currently have in place, as well as long as we have staffing that's sufficient. We are working very closely with the Virginia Department of Education to review our options and continuing the classroom portion of driver education as part of Health and PE 10. So stay tuned, but absolutely we are planning to continue to have behind the wheel take place for those families and students who have already signed up for it and plan to take it in the future.
Yes, sir. And being mindful of time, that will be our last question for this first session tonight. So I want to thank all of our panelists. And as was shared before several times over, for more information, please about the fall 2020 plan for instruction and learning, visit vvschools.com in our frequently asked questions section. There will also be a hotline available from Wednesday, July 29th through Thursday, July 30th. From 10 a.m. to 5:30 p.m. And this hotline is being set up to answer any questions that you may have. And that number, again, will be posted on our website, but is 757-337-1641. I ask that you please stay with us as we discuss health, safety, and transportation in our second session. And your facilitator or moderator will be Dr. Lakeisha Parrott, our Director of the Office of Diversity, Equity, and Inclusion. Thank you all.
Thank you, Mr. Jameson. For those folks who are attending, we just ask you to stay on. We're going to take a brief pause, and we will be back shortly, and we will be tackling many more questions which are related specifically to the non-instructional questions, and as Mr. Jameson indicated, health, safety, transportation, and some of those questions that we've gotten, which are quite a few. So please do stay on with us, and we'll see you in just a moment.
Good evening again and welcome back. And thank you for joining us for this evening for session 2 of our Virginia Beach City Public Schools Community Information Session. Part 2 will focus on health, safety, and transportation. I'm Lakeisha Parrott, Director of Diversity, Equity, and Inclusion. This session is set up similar to the first session. However, the questions that will be asked will focus on, again, health, safety, and transportation. First, I would like to introduce our lead panelist. As a reminder, each lead panelist has brought members of their team who may respond or elaborate on specific questions. I want to start by introducing Dr. Kip Rogers, our Chief Academic Officer, Dr. Don Robertson, Chief Schools Officer, Mr. Jack Freeman, Chief Operations Officer, and our Superintendent of Schools, Dr. Aaron Spence. Again, thank you all for joining us this evening. Dr. Spence, if you don't have any remarks, we'll jump into the questions.
Jump right in. Thank you.
Yes. The first few questions I would like to ask them to our Coordinator of Health Services, Ms. Mary Shaw. Ms. Shaw, thank you for being with us this evening. The first few questions that were asked of our community focused on our health metrics. As highlighted in our draft Fall 2020 plan, the have our health metrics. So here they are. There's a part A and a part B. So Ms. Shaw, what is considered to be the Eastern region when we are discussing our COVID cases, and why use the Eastern region and not our 7 cities?
Dr. Pearl, thank you very much. Good evening, everyone. I just wanted to make a quick comment before I answer the question. I'm the Coordinator of Health Services. I'm the lead health expert in the school division. And I really want to emphasize to you that Dr. Spence, school leadership and his teams have worked tirelessly in getting this plan developed. Health and safety has been the primary consideration through all of this process. I have been consulted through this process, and our partnerships with public health and with area healthcare providers, which is longstanding, is going to serve us well through this pandemic. So I want to reassure you that health and safety is at the top of the list in everything we do. So getting to the question from Dr. Perot about the Eastern region. The Eastern region includes Chesapeake, Hampton, Newport News, Norfolk, Virginia Beach, Suffolk, Portsmouth, Williamsburg, and some of the surrounding areas that border these cities. The Eastern region is being used in our health metrics because it is used by public health and by area health experts. And this health data is available daily to us from the Virginia Department of Health. It's collected from all of the different health districts in the Eastern region. The most important thing that you need to know that it's used because COVID-19 transmission levels in one city will impact the surrounding cities. This occurs due to the significant movement by our community when they cross over, when they visit, when they commute through, or when they live in these different cities. So to capture all of the things that are happening around us and to make sure that we're keeping things as safe as possible, that is why we are using the Eastern region metrics. Second question about the health data metrics, or did you want me to go into that?
Yes, please.
Okay, let's talk about the health data metrics. There are 2 Eastern region health data metrics that we will be using to determine the opening and closing of schools. The first one is the percent COVID-19 test positivity rate for 7 days. This is a percentage over a 7-day period of the number of individuals who tested positive for COVID-19 and how it relates to the number of all individuals that were tested. The second metric is the number of COVID-19 cases per 100,000 people in the Eastern region per week. Both are important key indicators of the level of community spread. The 7 days is used as there can be a variation in the data from day to day. Regarding the closing of schools, students should move to all virtual learning. If students move to all virtual learning, it's going to be based on the level of community spread. When that community spread rises to a substantial level that shows our health metrics in the red at greater than 10%, 7-day test positivity rate or greater than 265 new positive cases per day, and that information will be provided to you in our plan, that's when we're going to be looking at moving to possibly a closing of the school. That will be defined more to you and explained to you more, but in a general sense, that's how we're using the health data metrics. Thank you.
Thank you, Ms. Shaw. The next the next two questions will focus around health and safety guidelines, and I would like to address those questions to Dr. Robertson. Dr. Robertson, can you share with us how staff will be trained around our health and safety guidelines and the requirements around face coverings?
Yes, Dr. Perry, thank you. Yes, all staff, to include teachers, administrators, support staff, substitutes, and new hires will be required to complete health and safety training. Further, the health and safety training is based on guidance from the Centers for Disease Control, the Virginia Department of Health, and the Virginia Beach Department of Public Health. And yes, all staff and students will be required to wear a face covering while in school and in the presence of others when social distancing of at least 6 feet cannot be maintained. Examples when staff may choose to remove their face covering include when eating or drinking, when working alone in their classroom, when teaching from a location where they can easily maintain at least 6 feet of distance from others, or when they're outside supervising recess or PE and can again easily maintain at least 6 feet of distance from others. So student examples when they may choose to remove a mask or a face covering includes when eating or drinking, participating in outdoor activities where again he or she can maintain at least 6 feet of distance between others.
Thank you, Dr. Robertson. And so the next few questions that were asked by our community is around facilities. And so Mr. Freeman, I'd like to address those questions to you, sir. How will we ensure the sanitation of our school buildings and other buildings, as well as supplying hand sanitizer, cleaning wipes, and other cleaning materials?
Thanks, Dr. Perry. Certainly, that's a top priority for our custodial staff. So we have implemented enhanced cleaning protocols that include the use of safe, CDC-approved disinfectants. We focus on frequently touched common surfaces. You'll often hear them referred to as high-touch surfaces. We have new technologies like misters and sprayers that enable disinfecting of large portions of our buildings at night, over the weekends, or if a detection is experienced in one of our schools. And during COVID-19, it's necessary that we rethink how we think about disinfecting our spaces, because and some of the questions are related to how are the custodial staff going to handle this. But some parents appropriately saw and asked the question of, well, how do we distribute those so that we can leverage others in the building? So we are also going to ensure that disinfectants, again, safe CDC-approved disinfectants, are distributed throughout our buildings so that we're not reliant on just custodial staff to do that. We need a culture shift where everybody takes personal responsibility on how they clean and disinfect their areas.
Mm-hmm.
So we're going to position those up throughout the school. I'll again reemphasize the data that we're receiving about the spread of the virus and the importance of wearing a face covering and hand hygiene. So in order to support hand hygiene, we're going to ensure that all of the hand washing stations are full with soap and water, and we're going to distribute hand sanitizer, appropriate CDC approved hand sanitizer throughout the building so it is convenient to continue that good hand hygiene practice.
always a good practice, right?
Yes.
And more important now than ever. And what's also very important, Mr. Freeman, I'm just going to stick with you for another question, is our fall 2020 plan gets our students back on those buses and returning back to our school campuses. So can you share with us our plans moving forward in transporting our students back to school on school buses?
Yeah, and if I may, before I move on to school buses, I do want to circle back on one other item that's related to our facilities, and that's ventilation. So it's come up as that's a good practice to make sure that you have good ventilation in any of the spaces where you have people gathering. So we have redoubled our efforts as it relates to preventative maintenance to ensure that we have good airflow in all of our spaces to keep the air moving. In addition to that, there are times where it's appropriate to open your window. So this is Virginia Beach. It's hot and humid at times. It's cold and humid at times. So it's not always appropriate to open your windows inside a classroom to be able to get airflow moving. But there are times, and we're going to provide that guidance to our teachers of when we get into this temperate area, this shoulder season, where it's times that it's appropriate to open your windows and help to further ventilate airspace with some natural ventilation. So we're going to continue to focus on the maintenance of our HVAC units so that they continue to provide the airflow as designed, changing out air filters, things along those lines. All right, so you asked me about buses, so I'm going to circle back to the bus question. There's been quite a bit of work that's been done on that. And again, going back to some of the things that our health experts talked about is, school bus, we know that we're bringing a lot of kids into a relatively small space on a school bus. So the importance that we talk about screening by parents before their kids ever show up at a bus stop, wearing their face coverings, practicing physical distancing, not only when they're on the bus, but when they're at the bus stop, and using good hand hygiene. So in this case, we're talking about wash your hands before you get to the bus stop. When you're on the bus, limit the things that you're touching and handling, and then washing your hands once you've left the bus. So now all that being said, how the bus is going to be managed currently is we're planning on one child per seat. Now, the caveat with 2 children per seat is appropriate if they're from the same household. That's what our going in planning factor is at this point in time. And that gives 3 feet of separation between students. We can stagger them on within their seats, and we intend to put markers in them to show them where to sit so that they can safely continue to maintain the distance while they're on our buses. So this will equate to about 22 students per bus that we're able to handle, give or take, given that we can have some members in the household be on the bus in 2 to a seat. Obviously, that's a significant limitation as far as the numbers that we can transport that we're used to. So in between routes, so that means when the bus drivers have made an entire route and they have a little bit of time, in between those routes, we're going to wipe down the high touch surfaces with the CDC approved disinfectant so that when we bring the next route on, that they're starting with a clean and disinfected bus. So when conditions permit, we're going to lower the windows so that we get good ventilation that's flowing through the buses as we're transporting our kids. So the experts tell us that this is a good mitigation strategy, but I mentioned the limits on the number of students that we can transport. So that's why we're encouraging families to find alternative sources of transportation. So walk when you can. Even if you may be in a transportation zone, we encourage you, if you can and it makes sense, please have your kids walk to school or ride a bike. Or if you can, if it's something that you can do within your household, drop your kids off at school. All of this will help to be able to minimize the load on our school buses, and we can transport more kids to school and get them in the physical environment safely. All right, so all that being said, it is incredibly important from a transportation standpoint to be able to plan on the number of students. Our director at a school board meeting recently said we move the population the size of the city of Portsmouth on a daily basis. we move a lot of kids every day. So we really need to know exactly who requires transportation. So when the opportunity is there, we really need parents to sign up and say, we need transportation, and that is how we're going to design our routes, is based on who has applied for transportation. And that is because we are really close on our capacity and we need support in that regard. Several of the respondents noted the statement related to changing guidance regarding the number of students per seat. And that's relatively new, and that came from our Physicians Advisory Group. We need to have a little bit more discussion, and we'll provide updates when more information becomes available. But if it's deemed a good mitigation strategy by our experts, it will greatly improve the ability to get all students to face-to-face instruction. And keep in mind the statement from the American Academy from Pediatrics, American Academy of Pediatrics. They said policymakers should acknowledge that COVID-19 policies are intended to mitigate, not eliminate risk. No single action or set of actions will completely eliminate the risk of SARS-CoV-2 transmission, but the implementation of several coordinated interventions can greatly reduce that risk. And so with the goal of trying to safely get as many kids to school as we can, we're going to continue to pursue that and see where the data takes us and see if it's appropriate that we can move in that direction to be able to maximize the capacity on our buses. If we were to go this route, just as another reminder, this would have assigned seats, and essentially it would be cohorting of 2 students within a seat. So they would be sitting with the same student every day, again, minimizing the interaction that our students have across different peers. And as we learn more, we'll communicate it.
Yes, it'll be great to add it to our frequently asked questions, our FAQs on vbschools.com. So we definitely, as we learn more, we will definitely share that with our community. The next question I'm going to ask Mrs. Shaw, Mr. Freeman discussed wearing face masks on our school buses. And so some of the questions that were asked of us from our community is about the proper use or the proper wearing of a face mask to cover both the mouth and nose. What's our requirement?
You know, the wearing of a face covering is really a simple way for us to reduce the transmission of COVID-19. Evidence shows that it reduces the risk to others, and now it's starting to show that it's helping the person that's also wearing the mask or the face covering. So when a person is tested for COVID-19, and I'm talking specifically to folks that want to pull the face covering down below their nose. When a person is tested for COVID-19, they take the sample from the nose. And the reason they do that is because that is where most of the virus is in the nose. So if you think about that and you think that you're expelling anything from your nose when you're exhaling out your nose, then the majority of the virus that you may have in your nose is going to come out your nose. So it's important that that mask goes up above the nose, covers the mouth when you're wearing it. So the other thing you need to know with a mask is there's been a lot of research done on, are you getting enough oxygen? Are you getting too much CO2? Is this not healthy to have this on my face all day? The research shows that it does not change the oxygenation that you're getting when you're wearing a face covering. So the benefit of the face covering is going to help with to reduce the transmission. It is not going to be harmful to the person to wear the face covering, and the nose needs to be covered when the face covering is on.
Thank you, Mrs. Shaw. That's good to know. Dr. Robertson, as we look forward to fall 2020, what protocols will be used that support social distancing in the classroom and on our school campuses?
Yes, as we welcome our kids back to school, schools will be using cohorting of student groups whenever possible. And cohorting involves keeping a student group together for the entire day. So we'll be looking to try to maximize the effort of using the use of cohorts. We'll be designating one-way hallways or walkways or stagger class change transitions, again, to minimize the number of kids in the hallway at the same time. We will load and unload our buses one at a time. Our classrooms will have limited seating based on having at least 3 feet between desks. We'll establish clear markings of available seating in larger areas, such as the cafeteria, the gym, or any commons areas. And we'll have no large gatherings, such as assemblies, club meetings, and athletic events that exceed the governor's executive order. And we hope that these mitigation strategies will be embraced by our staff and students and help us reduce the spread of COVID-19.
Thank you, Dr. Robertson. And on that, as we continue to wear our face mask and practice social distancing, there may come a situation where a staff or a student becomes ill on our campus. So what notification protocols will be followed if someone tests positive for COVID?
Yeah, it's unfortunately, I mean, it's likely just someone's going to not feel well one day at school.
Mm-hmm.
And so let me cover that one first. So if a student or a staff member becomes ill or doesn't feel well at school, they report immediately to the clinic. The nurse will assess their symptoms and, if necessary, place them in an isolation area. If COVID exposure symptoms are present, the nurse will contact the coordinator of nursing services, who will begin the established protocols we already have in place for addressing an expected case of COVID. In terms of notification protocols, if in consultation with the Virginia Department of Health and Virginia Beach Department of Public Health, staff will be notified if they were present in the building on a day when a confirmed exposed individual was present. We will make every effort to notify anyone who the Virginia Department of Health or the Virginia Beach Department of Public Health felt was an exposure based on whether they were in the presence of the individual for a short time, a long time, and whether the health and safety protocols were in use. So we are going to do our very best to ensure that we provide notification to anyone who may have been exposed to someone who tested positive.
Thank you. Thank you, Dr. Robertson. The next question, Mr. Freeman. I know we talked a little bit about the buses and having our students sit in cohorts on the bus, one student to a seat, and our efforts on the school bus. But there was questions about if a student arrives at the school bus stop without a mask, what's our protocol?
Yeah, and this is where the balance of risk really comes into it. So number one, we're going to have disposable masks on our buses so that we can issue masks. But as a general rule, if a child is at a bus stop, we are not going to leave a child at a bus stop. We are going to ensure that they get safe transportation. As a balance of risk, it is better to take a student on a school bus, take them to school, and then address it as an administrative matter later on with the family to create improvements. That is a far better balance of risk than ever leaving a child at the bus stop, which we're not going to do. So in the case of a child that doesn't have a mask, we'll put a mask on them, we'll get them to school, and then there'll be a follow-up with the family of, hey, please ensure that your child comes to the bus stop with a mask for the future.
Thank you. And again, I'll stay with you for another question, Mr. Freeman, and it's around a very hot and very important topic around safety, and that is childcare. As we move forward with our virtual learning center, what are some considerations being discussed around childcare for our families?
Yeah, so the first thing that I would say is we hear you loud and clear. We understand the concern and the stress that is created by this challenge of childcare. We know it intuitively. We heard it through the surveys. We continue to receive your emails and other forms of feedback. We hear you loud and clear. We are working on it. It's a complex issue. So how we're working on it is we have partnered with the city and other childcare professionals within the city. So that includes Parks and Recreation, that includes the United Way, that includes the Interfaith Alliance, and that includes the United States Navy. We are taking all of those professionals that are involved in childcare and we're bringing them into a group and trying to figure out how to best support our families through childcare. So conceptually, one of the ways that that we want to do that is understand what childcare is available and help families to identify those resources. So one of the pieces that we're working on is, can we collectively in one place be able to show families, hey, these are the resources available in your area. These are the resources, the childcare facilities that are maxed out or have a waiting list. Don't need to call those ones right now. Here are the childcare facilities that have availability based on the last information that we got. Here's their phone number, give them a call. So that ideally parents can go to somewhere like a website, see those things, and start to be able to work through those. We have a lot of work to do, and we intend to communicate in the month of August before school begins what progress we have made and provide some tools and resources. And we are continuing to daily trying to find partners to pull into that can help us mitigate the challenges that are associated with childcare.
Mm-hmm. Yeah, and so we'll definitely keep everyone informed on dbschools.com and our frequently asked questions on where we are with childcare. Very, very important. Definitely a very safety efforts on our part. So thank you, Mr. Freeman. We do have time for a few more questions, and the next question, I don't know whether or not Dr. Robertson you want to answer, or Ms. Shaw. Let me find the question, right? And it's around screening, health screenings prior to the beginning of school. So will students and staff be screened before coming to school?
Yeah, so I can take that one, Dr. Parrott. Yes, all staff and students will be required to complete the health screening checklist each morning before they leave their house to report to the school bus stop or to report to work. And this checklist was developed from guidance documents noted by, again, the CDC, the Virginia Department of Health, and Virginia Beach Department of Public Health. So it is an expectation that every morning, both students and staff go through that health screening checklist.
Ms. Shaw, do you have anything you want to add to that? Are we're good?
No, I think we're good, but I think the thing I wanted to add is, should there be somebody that has any type of illness, signs or symptoms, or any question related to COVID-19, we have strong nursing staff in each one of our schools that'll be consulted and can also do an assessment on a particular student or an employee upon arrival.
Mr. Freeman, there was a question about supplies and about cleaning supplies and health supplies being available. It looks like on the school campus, I'm assuming, for staff. And so could you provide us some guidance there?
Yeah, so that we're committed. We have plans that are cleaning supplies, so the disinfectants that I discussed earlier, that we have those distributed throughout the building so that they're available to be able to grab that CDC safe and approved disinfectant to be able to spray down and wipe areas, and also to ensure that we are regularly providing I talked about the hand sanitizer throughout our schools. But so all of those supplies are there and available when needed to support the mitigation practices that we want everybody to be implementing regularly.
Dr. Parrott, I'd like to add to that answer. It's going to be incredibly important, and Mr. Freeman mentioned this earlier, that we recognize as a school community the importance of everyone taking care of kind of keeping their own areas clean. Mm-hmm. It's impossible to have an expectation that custodial staff will be able to get in and clean every high-touch surface in every classroom. So teachers will be expected to utilize the hand sanitizer, the disinfectant spray with gloves, before, during, and after each class rotation of those high-touch areas. I mean, we're going to all have to work together on this thing, mm-hmm. if it's going to work.
Mm-hmm. All hands on deck.
Yes.
Yes, definitely. And before we close, again, the final question, I'll leave this to Mr. Freeman and any other panelists that would like to share. You know, March 13th was a day that we weren't expecting. We didn't really plan for that day. And so looking forward, our community would like to know, for in-person schooling, how much notice will be given before we shut down schools, and will that allow for our students to gather their supplies and prep the students for their virtual learning sessions? And so again, just how much prep time will we have to provide to our families and to our community before we shut down school?
And thanks for that, Dr. Parrott. And before I go into that one, if we have a little bit of time, and we might have some less, if Dr. Spence's description, might have a couple other questions that we can help before we close this out. But to answer your question about how much notice is going to be given, so the way that it's structured is we're monitoring a 7-day average of our metrics. And when we get to the conditions where it's safe to go back to school, according to those 7-day metrics, we're now 14 days. So that's a relatively easy one. We'll be able to say, hey, 14 days from now, we'll go back. So if there's no substantial change that, to the data and it doesn't go in the wrong direction, families will be able to plan for that. So if we get into a situation where our schools are open and the data starts trending in the wrong direction, it's a 7-day rolling average. So we will be able to see when that detection is first exceeding a threshold. So we will communicate, we intend to communicate to our families, hey, we are in the Eastern region, we're beginning to see an uptick. Begin to make your preparations if in fact we do need to transition to a virtual learning environment. So then we would continue to monitor that trend. So that would give approximately 7 days heads up as we monitor the trend, that families would have that information to be able to make their preparations. Once we exceed that, we will need to quickly take action in order to be able to mitigate the spread. Now, all that being said, I do want to say, just to keep in mind, that is if we're monitoring the metrics. So there always is the chance, and just keep this in mind, that the governor would come out and make a declaration that is separate from us monitoring our metrics. And clearly, whatever the governor dictated, that's what we would follow at that point in time. So that is a case where we may not have much heads up about what's going on because we would be responding to the governor's direction.
Thank you, Mr. Freeman. And as you were talking, it made me think about when we talk about prep and being back in our schools and our classrooms, a very important part of the school day is lunch and breakfast for our students. Well, not in that order, breakfast and lunch on our school campuses for our students. And so, Dr. Robertson, again, how would lunch and serving of breakfast and lunch occur on our school campuses?
Yeah, so we've made some plans already to have food service stations throughout the school. We're going to do our very best to keep students eating in their classrooms, and when necessary, they would eat in the cafeteria, of course, spread out with marked desks or marked areas that would ensure social distancing. So a lot of work has been done, and Mr. Freeman's department under the leadership of Dr. John Smith, and we're in a really good position to serve lunches and breakfast next year to all students, whether that ends up being in the classroom or into larger areas where they can practice social distancing.
Yes, lunch is a very important part, and breakfast a very important part of the school day for all of our youngsters. So that's important to know that we're thinking about those things. Before we get into some closing remarks, were there any other questions from our panelists that you want to respond to? Again, we had over 800 responses from our community, so thank you all for taking the time to ask questions, and hopefully you found both parts 1 and 2 of our time together this evening beneficial, and that your questions were answered. But If your question wasn't answered this evening, please visit bbschools.com and go to our frequently asked questions section. Again, we also have a hotline. I'll tell you more about that in a moment, but I just want to pause and allow our panelists, if you had something else you would wish to add before we get into closing remarks. Mr. Freeman.
Yeah, so thanks for that opportunity, Dr. Parrott. So we had a great question from a parent, and this goes back to the discussion that we had about being able to use alternative forms of transportation to be able to get your kids to school. And so one of the questions was related to that they don't live in a non-transportation zone, but they are in walking distance from a school. But their concern is that they live, there's a major thoroughfare between them and the school. And is there a possibility of getting additional crossing guards? So number one, I completely appreciate that thought, because that is a helpful way for us to be able to approach our ability to be able to get more kids in a face-to-face learning environment. So that's number one. Number two, please always use the safety measures that are already in place. So for example, major thoroughfares will typically have crossing areas, they'll have lights associated with them. Please use those things. But the ultimate point that I want to make is if you identify things like that that you think can be improved, please communicate those to your schools. And we will do the best that we can to support additional safety measures because anything that we can do to work as a group, work as a community to make this easier and better for us, we will be better off for. So that's an example of an item to be able to work with your school, and we'll do our best to support you on being able to put safety measures like that in place.
Thank you, Mr. Freeman.
Dr. Perrault, I'd like to make a comment if that's possible.
Yes, please.
I want to talk to the families who have children that need medical treatments and medications in school. And I really want to reassure you that we've set up specific mitigation in the clinic with the nurse and the folks that will be providing this as far as PPE, because they will have closer contact with your children to make sure that they're safe. It's all evidence-based. It's all been supported by public health. So if your child needs medications and treatments in school, we're certainly set up to provide those for your child.
Thank you, Ms. Shaw. So again, once again, I'd like to thank our panelists for their time and thoughtful responses. I also like to thank our Virginia Beach City Public School community for submitting over 900 questions for our reflection and for our time this evening. We hope this information session answered and clarified many of your questions you may have. And I know you still have more questions, and we have questions too, but we're going to get through this together, I guarantee you. So for more frequently asked questions or FAQs and other information, please visit bbschools.com and look for the FAQ link. We will continue to add to our frequently asked questions as we get questions from you. As we continue to ask our own questions, we'll continue to add to that document as we move forward in our fall 2020 plans. Another opportunity to have your questions answered, we will set up a hotline very soon. To access the hotline, the phone number is 757-337-1641. Again, to access the hotline, the phone number is 757-337-1641, and the hotline will be available on Wednesday, July 29th through Thursday, July 30th from 10 a.m. to 5:30 p.m. And again, more information about the hotline and the phone number will be located on bbschools.com, and I believe we'll have a slide at the end of this session that also has that information displayed. On behalf of Virginia Beach City Public Schools, thank you for your time this evening, and enjoy your evening, and we can't wait to have our students back with us. And again, be safe, and we'll see you soon. Good night.